Let's get more on this from our health correspondent, Nicola Hill in London. Nicola, this is very concerning. Tell us more about this study.
Yes, it is, Rachel. I mean, we've heard in the past about the fact that the COVID-19 pandemic has had a major impact on people who've been waiting for treatment in the first world countries, particularly cancer treatments. But what this study is saying is it's going to have a devastating impact on those three diseases that you mentioned, malaria, TB and HIV and AIDS. Now, I have to say this is a modelling study and one of its authors is Professor Tim Hallett, and I spoke to him. He said to me what they've done here is they've worked out a possibility. It's not a prediction, it's a possibility. But he said to me it's a real possibility that if changes aren't made, if precautions aren't taken, that this could happen. He said that the reason there's several elements here. So one of them is the fact that people are too frightened to go and get treatment, see doctors, because of the fear of contracting COVID-19, particularly if they might already have other diseases such as HIV. And then, of course, there's the fragile health systems in countries, parts of sub-Saharan Africa, which are completely overwhelmed anyway. They just can't deal with the impacts of coronavirus on top of that. And the figures that you just said there, they said with malaria in particular, what they're worried about is the stopping of the distribution of those insecticide impregnated nets, the bed nets that they need to protect people against malaria, particularly children, as well, of course, as the prophylactic drugs and treatments for that. With TB, the concern is, because of social distancing, may well be a lack of diagnosis. And of course, as we know, TB is contagious. So of course, if one person gets it, they can then spread it. So they say it's important that, people should still get diagnosed and treated for TB. And with HIV, and in parts of Africa, in southern Africa, 20% of the population between the ages of 15 and 49 have got HIV. If they're not getting access to the drugs they need, the antiretroviral drugs that they need, then they say there could well be a spike of an extra 10% of deaths over the next 5 years, and this could even go on for longer.
Nicola, with hospitals overwhelmed, the supply chains interrupted, is there anything that can be done to prevent this?
Well, you say about supply chains, that's one of the things that Professor Hallett said to me. He said, the raw materials come from China, the drugs are manufactured in India, then they have to be shipped to where they're needed. You've got all these quarantines coming into place in ports. So that's definitely something that's concerning. And the reason they've published this study, the reason they did this study, was to make people aware of the need to get provisions in place. Now, he said the things that can be done, certainly with people who've got HIV and AIDS, they can have something called community pharmacy lockers where drugs can be put in there, so they don't necessarily have to go and see a healthcare worker. People could be given 6 months supply at a time, although of course then there's a concern, are they going to run out because of this? There's fears that, he actually said to me, the long-term impact going beyond 5 years. So their study looked for 5 years, but it could go beyond that. It could be an impact on drugs pipelines and other situations like that. So it's a question of raising awareness, and it's a question of preparedness and doing that now so that systems are in place. And by them making this study public, they want these systems put in place so that you can prevent this, because as he said, if nothing is done, you could equal the numbers of people who are being infected and dying of COVID-19 with these diseases. 380,000 people died of malaria in 2018, and he fears if nothing's done within 5 years, that number could be increased by a third.
Wow, it's terrible. Nicola Hill in London. Nicola, thank you so much.